Welcome to the Zika Town Hall meeting at the Mount Vernon Government Center. I'm Janine Harris. I'm the Communications Director for Supervisor Dan Stork. And I want to thank you for coming out tonight to learn more about Zika virus and how to prevent infection and transmission. As you may know, this is one in a series of meetings that's being held across the county. And remember that controlling Zika is everyone's job. So we must all fight the bite. We're honored to have with us tonight the Fairfax County Health Department, and they will discuss the agency's mosquito and human surveillance efforts and possible interventions. So on behalf of Supervisor Stork, county staff, and the Mount Vernon District community, welcome. I'm pleased to have you here. Thank you for coming. I would like to introduce our first speaker for this evening, and that will be Sean Kiernan. He's the Communicable Disease Epidemiologist Supervisor with the Fairfax County Health Department, and he will be our first speaker. Welcome, Sean.
Well, thank you so much, everyone, for coming out. Again, my name is Sean Kiernan. I'm one of the infectious disease EPIs at the health department, and pretty open format for the presentation. So if you guys have any questions, obviously, just stop me at any point and we can jump into questions. We're pretty open with questions or anything like that. So just what we're going to talk about today. So as my job title implies, I am epidemiologist at the health department. So I'm going to talk a lot about the clinical information and the epidemiological information as it results to Zika virus. The second portion of our presentation is done by Andy Lima, our entomologist. He will be talking about mosquito control measures that we can put in place in Fairfax County to prevent the spread of Zika virus locally. So, about Zika virus, the first thing about Zika virus isn't new. It's been around for about 70 years. First discovered in a Ugandan forest in 1947 in Africa. So it's been around for a while, a little bit more. That's a little surprising for everyone out there. The smaller outbreaks that happened in 2007 and 2013, 2014 were known by epidemiologists, but obviously Zika really hit the news with the large outbreak that started in Brazil in 2015. So you can see from the timeline in front of you, the outbreak started in April of 2015. It spread throughout Central America, and we had our first case in Puerto Rico in December of 2015, our first case of a traveler from Virginia in January of 2016. The World Health Organization declared an emergency of international concern in February of 2016. And just recently, a couple weeks ago in Florida, we saw our first local transmission in the continental US. So that's kind of the main timeline pieces when it results to Zika virus. Looking at our map, so the big disclaimer with the map is if anyone is thinking about traveling to a country in South, Central, or the Caribbean, you want to consult with this map to see the countries where there is active transmission of Zika virus. You can see the orange is indicating countries that are affected by Zika virus and where they're seeing local transmission. So most countries in South, Central, and the Caribbean are seeing those. But just a word of advice, if you're traveling to any countries in these areas, check on the CDC website to see the most updated list of these countries. When we jump in the US, you're going to see a lot of blue obviously here. The darker the blue, the more cases we see. Now granted, we've only seen local transmission in Florida as of right now. But what we do see is we see a good number of cases across the country. And that's how we would see local transmission if we have travelers come back and they're bitten by mosquitoes here. And we're going to go into transmission a little bit more. But just we are seeing a lot of cases obviously in the larger states that see a lot of travelers from those regions. The local transmission that we do see is in Florida right now. The two that the CDC have designated a geographical area for and that they've published a map for are the ones that are indicated on the map here. It's in Miami Beach area, and the first one in the Wynwood district. They have also reported local transmission in Tampa, but they haven't released a map yet for that, so stay tuned for that. This is expected. We're expected to see more and more transmission in Florida, so obviously as well, if you're planning to travel to Florida, review all the CDC guidance on where there is transmission in any state in the U.S. as well. Okay, how do you get Zika virus? Our primary method of concern for transmission with Zika virus is being bitten by an infected mosquito. So how that would happen locally is if someone traveled back from one of those countries with Zika virus, they're bitten by a mosquito while they're still viremic or infectious with Zika virus, and then that mosquito virus feeds on another individual, transmitting the Zika virus to that individual. So that's our primary method of transmission that we're really concerned about with Zika virus. The mosquitoes that are known to transmit Zika virus are Aedes aegypti and Aedes albopictus. Unfortunately, we do have Aedes albopictus in Fairfax County and across the rest of Virginia. Other transmission methods, a big concern obviously with Zika virus, there's been a lot of outreach efforts towards pregnant females. They're a very high-risk group for Zika virus, and I'll go into that a little bit more later. But a pregnant woman can pass Zika virus to her unborn fetus as well during pregnancy or around the time of birth. We've learned a lot about Zika virus. One of the things we have learned is that it can also be sexually transmitted, both from a male to a female and a female to a male. And then, like any other infectious disease, there's a strong possibility it can be passed through blood transfusions as well. So that's why you may see when there's locally transmitted disease in Florida and other areas in the U.S., you might see that they're stopping blood draws and they're doing screenings on blood that is drawn. Clinically, what are we looking at for Zika virus? The four main symptoms are fever, rash, joint pain, or conjunctivitis or redness or discharge from the eyes. Those are our four classic symptoms. We're seeing about, give or take, 80% of our cases with that rash. So the rash is really the distinct symptom for Zika virus, but we see all four of those symptoms pretty classically with our cases. Our time frame from exposure to symptoms is about 3 to 14 days. And unfortunately, as of right now, there is no vaccine or medications to treat Zika virus. So you're treating symptoms more so, you're not treating the actual infection. Clinically, jumping into the symptoms as well, usually a pretty mild illness. Again, we're worried about pregnant females. I'm going to jump into that in a little bit, but mostly we're seeing a very mild illness. Actually, 4 in 5 individuals don't even show signs and symptoms of Zika virus, which is actually scary from a public health perspective because someone can be asymptomatic and they can be transmitting the disease. So that's a little trickier for Zika virus. So we're only seeing symptoms in about 1 in 5 individuals. When symptoms do occur, they last from several days to about a week. We rarely see hospitalization, and death is rare. One of the more severe clinical syndromes that we do believe is associated with Zika virus that hasn't been proven yet is Guillain-Barré syndrome, also known as GBS. I'll talk about that a little on the next slide. But it is believed once a person has been infected, they're likely to be protected from future infections. So you build up an immunity to Zika virus and you don't develop Zika virus anymore. GBS, just touching on it very, very, very quickly. There is believed to be a link. CDC is looking to see if that link is proven or not. We see GBS actually develop with some some infectious diseases, and it appears that Zika virus is one of them. What GBS is, as you can see from the slides, it's a rare disorder where a person's own immune system is attacking their central nervous system, causing muscle weakness and sometimes paralysis. Usually people recover from this, but it can take several weeks, and in rare cases we do see death from GBS. As I've mentioned before, pregnant women are our main concern. The major concern we have with pregnant women is the development of microcephaly in the fetus. As you can see from the picture there, microcephaly is just a smaller head size development, so it's a severe birth defect. The prognosis of the child varies depending on the severity. So obviously the smaller the head size becomes, the more severe that birth defect can be. How they found this link, they first noted a significant increase in the number of microcephaly cases in Brazil during the course of this outbreak. So here in the US, we see about 6 to 9 cases of microcephaly every 10,000 births. That just happens naturally. That's the baseline number. So what they saw in Brazil was a much higher number of microcephaly cases. Eventually, the CDC was able to put together the epidemiological data and the clinical data to prove that there is a link between Zika virus and microcephaly. If you've ever heard Dr. Frieden speak, the director of the Centers for Disease Control, about Zika virus, he calls it an unprecedented infection due to the fact that we've never had an arboviral infection cross over from a mother to their fetus. So that's why this is a large-scale public health response for this. That's why there's a lot of public health messaging towards pregnant women to avoid mosquito bites and avoid Zika as much as possible, because these are obviously severe birth defects for a highly susceptible population. So what are we doing here in the U.S.? Well, right now, because so much is unknown about Zika virus, one of our main tools from a public health perspective is collecting information. So we can do that through many ways. The main method we're doing that right now is through our pregnancy registry. So every pregnant woman that we test who is positive for Zika virus, we're trying to get them enrolled in the pregnancy registry. What that's pretty much doing is collecting a lot of clinical information along the course of that woman's pregnancy, and also following the infant during their first year of life to see if any other birth defects or anything else is occurring within these children. Once we get a lot of information, all of it goes to the CDC, where they can analyze that data to see if there's links between anything else or what the true link between Zika virus and any sort of other adverse events are. Who's included in this? So we have women all throughout the state of Virginia that are included, but like I said, it's women with lab evidence of Zika virus infection. Okay. Our recommendation for pregnant women: if you're thinking of traveling to a country with Zika that is affected by Zika virus, the recommendation is don't travel. Obviously, because of the things I just stated, with the concern with microcephaly, we don't want to see women traveling to these areas. There's also the recommendation that if your male partner travels to these areas, because of the risk from sexual transmission, that you use condoms during sexual intercourse, or you do not have sex during the course of your pregnancy. So jumping right into sexual transmission, a lot of the questions about sexual transmission are still unknown, but this is what we're recommending right now. These are the CDC recommendations. So this is to prevent sexual transmission of Zika virus. This is how long we're recommending individuals wait before they have sex or they do not use a condom. So the recommendation for a woman with Zika symptoms is to wait at least 8 weeks after the symptoms start. For men, it's to wait at least 6 months. It's believed that the Zika virus persists longer in semen. If the individual does not have Zika symptoms but still travels, we're still recommending that 8-week time period for both men and women. The reason for that is because we do know that 4 in 5 individuals don't develop symptoms. So it's a conservative approach to try to avoid sexual transmission of Zika virus. Okay, so jumping into traveler recommendations. So again, the recommendation to avoid Zika virus is to not travel to areas where there is local transmission. We obviously understand that sometimes travel is unavoidable, so the best method of protecting yourself from Zika virus is to ensure you're not bitten by a mosquito. So packing to prevent is a big thing. Andy's going to go into a lot more of these, but you want to try to avoid mosquito bites as much as possible. Sleeping indoors in a screened room obviously does a lot to protect you from getting bitten by a mosquito as well. The big recommendation to avoid local transmission here in the U.S. is, even if you feel sick or not, you're viremic for about 3 weeks. You're able to transmit the disease to other individuals through mosquito bites for about 3 weeks. So what we want to do is for people who come back from these countries, even if they don't exhibit symptoms, to try to avoid mosquito bites as much as possible for 3 weeks. That's our main prevention method to stop Zika from being spread locally here in the U.S. So what are we doing right now from the Fairfax County Health Department perspective? Andy's going to go a lot into the vector control side of things, but from a communicable disease epidemiological standpoint, we're doing human surveillance. So right now, the communicable disease epidemiology unit at the Fairfax County Health Department, they're the ones actually approving testing for Zika virus at the state lab. So providers are contacting our unit and asking if they can be tested for Zika virus. We're approving individuals for testing, and we're facilitating that testing process. We're also counting, obviously, our cases. We want to make sure our case counts and our numbers are accurate every week. The Virginia Department of Health posts statewide numbers of Zika virus infections as well as regional numbers on their website. So those are available for individuals. We have almost 70 cases in the state of Virginia of Zika virus. The disease-carrying insects program does the mosquito surveillance side of things. So the communicable disease epidemiology side is the human side, and then the vector control side deals with mosquito surveillance and mosquito control. If we did find local transmission or something was indicative of local transmission for us, that's where we'd really ramp up our actions to kind of parallel what you're seeing right now in Florida, where we want to really, our goal from a public health perspective is to avoid that local transmission. So what we want to see is we want to destroy mosquito breeding sites, conduct pesticide treatments, as well as collecting urine specimens on individuals to see if there actually is continued transmission within the community. Okay, so I'm going to introduce Andy Lima. He's our entomologist here at the health department, and he's going to cover mosquito bite prevention and control.
All right, thank you, Sean. So I do work with our disease-carrying insects program. We do a wide variety of activities, but generally they're focused around education, public education, trying to really change personal behavior because that's the easiest way to prevent Zika virus. And we also do a lot of mosquito surveillance activities that I'll talk a little bit about, and then potentially mosquito control when it's necessary to do so. So we start with Bite Buster here. He's one of our calendar characters, but he's letting us know that we really need your help when it comes to fighting Zika virus. It really is everyone's responsibility because there's two main things that are very simple that you can do to reduce your risk, and that's to prevent these mosquito bites and to tip and toss standing water from around the yard. That you're throwing away this water. Eliminating those habitats is going to make it so the mosquitoes can never come up and bite you in the first place. So. It starts with you guys. And so when it comes to the mosquito life cycle, they can go from an egg to a flying adult in about 7 to 10 days. So when we talk about cleaning up the yard and a lot of the activities that you can do to reduce mosquitoes around your property, doing them weekly is really important because that effectively interrupts that life cycle. Once a mosquito is an adult and is out and actively flying, on average they live about a month. And during that time period, an adult female mosquito can get a few different blood meals, and each time she gets a new blood meal, she can produce new eggs. So all of this life cycle is connected to water. And in the case of Asian tiger mosquitoes, which have the ability to transmit Zika virus potentially, that development takes place exclusively in containers, much like the ones that might be found around people's yards. So they have this egg stage when the eggs are covered with water or they're laid directly on top of the water. They hatch, they turn into a larva. That larva is going to breathe from the surface from a siphon that's like a snorkel coming off of its abdomen. After they're in that stage feeding for a while, they're going to turn it into a pupal mosquito. And that pupa is not going to be feeding or anything, but it's going to be really the adult mosquito that's developing inside of there. And then the males will generally emerge first. The females will then come off. Usually mating takes place quickly after they have emerged as adults, or sometimes the males will hang around hosts just like a female would because they know the females are coming for blood and they can mate during that time period. But once that female mosquito mates with the male, she's going to store the sperm from that and be able to use it for every clutch of eggs that she lays thereafter. So she won't need to remate each time she wants to lay eggs. In terms of the mosquitoes that can transmit Zika, there are two species that are known. They're from the genus Aedes. They're from a specific subgroup called the Stegomyia mosquitoes, but it's really these two main mosquito species that we're most worried about. They're very biologically similar. They do have some important differences in terms of their ability to transmit Zika from what we've seen so far. Aedes aegypti, the mosquito on the left, also known as the yellow fever mosquito, can transmit all of these pathogens that you see in the middle: dengue, Zika, chikungunya virus, yellow fever. So this is the second most medically important mosquito in the world after some of the Anopheles mosquitoes that transmit malaria, mostly in Africa. But here in Virginia, it's very rare for us to see that Aedes aegypti mosquito because they're a tropical and subtropical mosquito. So if we do see them, we see them in very small numbers, as in like maybe a single to a handful of individuals in an entire summer, whereas we can see hundreds or even thousands of our Asian tiger mosquitoes in a single trap in some places in the county. And this is our number one nuisance mosquito in the area. So our Asian tiger mosquito, Aedes albopictus, hasn't yet been implicated in this outbreak, but we know it's a potential vector. It's not as efficient as the Aedes aegypti mosquito, but we still are concerned and ready and enacting our control measures to limit that mosquito's distribution, because we know it's here. But that's going to be the species that's most important for us here in Fairfax County. Down in a lot of places in the places in Florida where transmission's ongoing right now, that's mostly due to Aedes aegypti. All of the transmission, most of the transmission, all that's going on in Central South America, the Caribbean, Mexico, all due to the Aedes aegypti mosquito there. So that's a bigger worry for them down there than it is for us here. So our Asian tiger mosquitoes, they do lay their eggs strictly in containers around the yard, especially artificial containers that have artificial surfaces. Usually anything with a natural bottom on it is not going to attract these mosquitoes as a place to lay their eggs. Most of the time it's going to be something that's smaller than about the size of a large trash can. Anything larger than that will be occupied by some other mosquitoes maybe, but usually not our Asian tiger mosquito. They do feed on a wide variety of hosts, but they have a preference for humans. So it's a little something that's different with them and the Aedes aegypti mosquito. That mosquito feeds almost, more than 90% of their meals are coming from humans, and that makes the transmission cycle a lot more direct with that species. So that's a benefit that this thing our Asian tiger mosquitoes also feed on a wide variety of other hosts. They do have a relatively short flight range for a mosquito, so they probably spend their majority of their life in an area about the size of a football field. And they're going to fly less than 150 meters in their lifetime for blood meals, compared to some other species of mosquitoes that can fly maybe 20 miles or more for a blood meal. So usually, if you can do the control measures and eliminate the larval sources around your yard, if you're being bothered in your yard, it's likely that those larval sources are very nearby, and luckily for you, you can go and dump those out and save yourself a lot of mosquito bites for the summer. They're urban and suburban species that do really well around human habitations. They do much better around human habitations than anywhere else, like the middle of a forest or something like that. So it's important that we take these steps around those areas. Another unique behavior is that they will bite actively during the daytime. For most mosquito species, they're going to be most active at dawn and dusk and then through the evening hours. But for our Asian tiger mosquito, they're resting in vegetation during the day in a nice, cool, humid place, things like English ivy or really dense plants. And then as a host comes by, they're opportunistically coming out to take a blood meal and then go back into that area to digest it for a few days to a week and then find a place to go and lay those eggs that it's been able to produce. So it's important that we take these prevention steps, especially around dawn and dusk, but also during those daytime hours if you're going out to work in the garden or something like that. And they do like to rest in that vegetation. So for here in Fairfax County, some of the things that we're doing is a big education and outreach push. That's why we're here tonight. And we appreciate everyone taking the time to come out and hear the message, because we do need your help with this. And a lot of what we're trying to enact is that behavioral change in people so that they understand that they can control their problem. We can help them, but we can't do it for every yard in a very large county. So we need your help, and hopefully, through some of our materials and through talks like this, we can get that word out there. In terms of mosquito surveillance, we have 71 trap sites around the county that we've been monitoring since West Nile virus first arrived in Virginia in 2002 and 2003. And so we've used a lot of those same trap networks to be able to install newer and more specific traps that really target our Asian tiger mosquito population. So we quadrupled the number of those traps that we have in our regimen that can specifically attract those Asian tiger mosquitoes. So that's what you see here in the center, is a BG Sentinel trap. It's got an appearance on it, and it uses that's attractive to mosquitoes. It also has a lure inside that smells kind of like sweaty socks. And it smells like a human that might be perspiring or something like that. And it's also baited with carbon dioxide, so we use dry ice, and that actually brings the mosquitoes in. So those mosquitoes that we collect from around the county and also from some of these investigations that we're doing for Zika cases, we can test those mosquitoes for Zika virus and look at what our infection rates are. And so far, we haven't seen any Zika virus in our local mosquitoes. And anywhere in the U.S., there really hasn't been much detection of Zika in the mosquitoes themselves. We're really depending a lot more on the human surveillance to know where we want to do our mosquito surveillance. So that's where they go hand in hand, as Sean was talking about. So from the control aspect, really what we want to do is get rid of these habitats, the larval habitats, completely. So if we can throw away containers and eliminate them completely, then we know that we're taking those mosquitoes off the street for as long as we can keep the container out of the yard. If there are areas that we can't get rid of the water, so some people like to have a rain barrel or something like that, they could always screen the top of it to prevent mosquitoes from getting inside. But if they don't do that, then mosquitoes can get in there and lay their eggs and have a great production site for the entire summer. So you can treat something like that with a larvicide, something that'll control the mosquito larvae that would develop in the water. It usually lasts for about a month, and these are bacterial pesticides that are actually going to act very specifically on mosquitoes and won't harm your non-target organisms like beneficial bugs that might eat mosquitoes, or birds that come to visit, or even fish and frogs and things like that. In terms of adulticides, things that kill adult mosquitoes, the preferred method of treatment is really these barrier treatments, usually done from a backpack, or for homeowners, there are formulations that you can buy at the hardware store that you would hook directly up to a hose. So usually it's an active ingredient that mixes with water. When it's treated onto the vegetation, it creates a residue on there that will last for 2 to 3 weeks and provide control of the adult mosquitoes that come and land in those areas, or until you get a strong rain that washes it off of those leaves. So this is a little bit different than what a lot of people might think about when it comes to mosquito control. You might think of the truck driving down the street and spraying out to the sides, and that's a contact that's being done at that moment. Those mosquitoes have to actively be flying to be contacted by that spray and killed, but this is going to provide a residual effect that'll last for a couple of weeks after the treatment. So that's important in those areas where we have those Zika cases that come in, where we see high numbers of mosquitoes on those properties. We need to sometimes initiate that control, but always as a part of an integrated program that thinks about things like the education and like the surveillance, and does these things in very targeted ways, and in ways where you're following the directions on the label, and where they're done by certified applicators that are certified to treat with those products. So if we get what we call a travel-associated case, or you might hear us call it an imported case, it means that an individual traveled to a Zika-affected area, they returned to Fairfax County, or they saw a provider here in Fairfax County, and they were symptomatic. They were showing signs of illness during their time back here. So in those cases, we would talk to that individual on the phone. After Sean's group has gotten done doing some of their investigation, they would notify us on the mosquito control side to go and do a site investigation. During that investigation, we would educate the patient, about avoiding mosquito bites, because we do want them to avoid that, especially during their symptomatic period. And we would also go and do those things that we talked about, the source reduction, getting rid of the containers, larviciding when we need to. We would also be setting a trap in that yard to be able to collect adult mosquitoes and test them for Zika virus. And that's also what's going to give us our threshold for treatment. If we hit a certain number of mosquitoes in that yard and it's a Zika positive case, then we know we want to initiate control. And the most important control measure at that point is knocking down the adult mosquitoes, so we would consider using something like those barrier treatments that I described. In terms of local transmission, so when we talk about local transmission, we're really talking about mosquito-borne transmission by our local mosquitoes. So if a person has not traveled to a Zika-affected area, they've been just here in Fairfax County, and they were bitten by mosquitoes, but somehow they tested positive for Zika virus, then we know that somehow it's gotten into the local mosquito population, and we need to expand our radius of the area that we're looking at where we're trying to provide these control measures. So we were going to do those same activities that we did on the case property for an imported case, but we're going to expand that out to a wider area to include maybe neighboring properties, or out for a certain distance around that to cover some of the flight range of those mosquitoes that might have come out, to help keep that risk of Zika in that area down by providing the control measures and the surveillance. If we get local transmission here in Virginia, you'll definitely know about it. You see how big it is in the news when it's hit us in Florida here in the United States. So a lot of people are kind of rekindling their interest in Zika based on the fact that it's made it to the mainland United States right now. So there are some simple things that folks can do to prevent mosquito bites, and a lot of these things might seem like common sense things, but it's good to remind and think about them. Because they're simple ways that we can reduce our risk, and it's going to reduce your risk of getting nuisance bites around your yard too, because 99% of the time the mosquito that's bothering people in their yard is Asian tiger mosquito, and we need to be able to control those. So just participating in your neighborhood, doing a cleanup, especially stream cleanups. Streams deposit a lot of trash, and that stuff that's sitting on those banks or in those culverts where the water comes out can accumulate water and be a big producer of Asian tiger mosquitoes. So, and then just sharing that information with the folks that you know is important. if you see that your neighbor has a bunch of containers on their property, maybe you can let them know that you learned from the health department that these things produce a lot of mosquitoes, and they could call us and have us come out. We're happy to come out to folks' residences if they are in the county, and check out their yard and look for some of these mosquitoes. Elimination of standing water is key. None of our other actions are going to be effective if we can't get rid of the larval sources in the first place, because you're just going to get reinfestation. And this is really what they've been seeing in parts of Miami where they've done their treatment. They've seen a lot better results where they were doing larviciding alongside adulticiding, where they just did the adulticiding and they controlled those adult mosquitoes. They got the reinfestation coming back. So really those things in combination are important. But you're doing these things weekly to interrupt the life cycle. You're eliminating and throwing away those containers when you can. If you can't throw them away or you don't want to, store them somewhere that's covered or make sure they're turned over. And use a larvicide if you can't get them emptied out. So these are some examples of different containers that you might see. A lot of these are cryptic habitats that folks might not think about. But things like potted plants, if they've got dirt in them, that's fine. It absorbs the water. You don't have that sitting water. But if it's the potted plant saucer at the bottom, like this here, that's going to be perfect for mosquitoes. And they really don't need much water to be able to survive. So things like tire piles can prolifically breed Asian tiger mosquitoes. Just trash that's laying around, tarps that aren't properly placed. Corrugated downspout extensions are a big one. Most places in Northern Virginia that I see have these extensions coming off of their gutters, and these can hold water for extended periods of time because it's not properly evaporating from there. And they've got little corrugations in them that are going to each of them hold a little bit of water. So if you have these in your yard, it's really important to make sure that they're angled at a good angle, that they're going to be draining that water routinely, or that you take them off and empty them out after you get a big storm. I mean, they can store gallons of water inside them, and that's plenty of that mosquito has no problem flying down that long tunnel to get in there to the water and lay her eggs. So just keeping an eye out for these kind of habitats around your yard, or letting us come out and take a look can really help with the problem for you. So places that don't produce Asian tiger mosquitoes are a lot of the places that most folks might think of when they think of mosquitoes. They're thinking of the pond behind their house, or the creek that kind of stagnates a little bit, or the woodland pools that come out in the spring that they see. But we care about these habitats in terms of mosquito production, and we might even still want to do mosquito control activities in these places. But for the purposes of Zika, we're looking for containers, especially those that are found around people's yards. So it's really it's a shift in the way you need to think about, because we can't get to, they're not public areas that we're dealing with. We need folks on private property to do their part, or let us help them do their part. So, yeah. When it comes to doing those treatments like I was talking about, you do want to focus that treatment on areas that have really dense vegetation or might be well shaded. Places that in the yard where when you're going around and walking or gardening or just checking out your yard, where you see that adult mosquitoes are hovering around your legs. Those are Asian tiger mosquitoes. And when you know that, then you know where you want to do your treatment. So you want to use something that specifically states on the label that it does control mosquitoes, and then you want to follow those label directions exactly to be able to use the product in as safe and effective as a manner as possible. And when it comes to using pesticides and things, these are part of the major plans that come from Centers for Disease Control and also from Virginia Department of Health. Pesticides are an important part of those plans, but they're not the only part. We need to do those proactive things before that. And then use this as another tool to help maximize the control and keep the control for long-lasting periods of time. Dress to protect, that just means keeping covered up. So long clothing, loose clothing. If it's light colored, then it's less attractive to mosquitoes. It also makes it easier to see if they're hovering around you. But making sure it has a loose fit so that they're not able to as easily penetrate through, because mosquitoes can bite through clothing. They have very small mouth parts. And even if you've got a really tight mesh on what you're wearing, then they can probably still get through there. So having things be a little looser keeps them away from your skin a little bit. And there's also an option for treating your clothing with permethrin, which we have another slide about, but permethrin is actually an insecticide that's labeled for use on clothing. It has some repellency qualities to it, and it can provide a contact kill in some cases too when it's been freshly applied. When it comes to repellents, there are 4 main active ingredients that are recommended by the Centers for Disease Control and by the Environmental Protection Agency. These are active ingredients that have been vetted over a number of years and proven to work against mosquitoes. So you might hear a lot of alternative options out there. And we don't want to discourage people from using a repellent that if they really find that something that's alternative to these works for them, then good for them. At least they're wearing a repellent and doing something that works for them. But we say the best repellent is the one that you will use. But you really want to focus on these 4 active ingredients, especially DEET is it's really a gold standard. It's been around for 60 years. It's the only active ingredient that's been proven to protect against ticks as well as mosquitoes. And we've got the most data on that. It was developed by the USDA, and it's safe for use on women and pregnant women and children as well. But you've got some other alternatives too. Oil of lemon eucalyptus is a botanical formulation. IR 3535 you may see in some Avon Skin So Soft products, and picaridin is a common one that you see too. That's been used in the United States for about 20 years now. So you want to always follow and read and follow those label directions. They're going to tell you where to apply it, whether just to clothing or generally speaking, it's usually on your clothing and exposed skin. When it comes to sunscreen, we want to use that first and then put our repellent on top of that. So for kids, a lot of the recommendations are pretty much the same, but reading and following those label instructions is important. You can use DEET as long as kids are older than 2 months of age, and that's a recommendation that comes from the American Academy of Pediatrics. Something like oil of lemon eucalyptus, you might intuitively think, hey, it's botanical, it's natural, I'd rather use that on my young kids, but that actually has right on the label that you need to have kids be 3 years old and up to be able to use it. So really important to read that information on the label and then apply it accordingly. When it comes to applying to kids' face and also to your own face as an adult, you want to spray it on your hands and then apply to the face that way, rather than spraying in the face or something like that, because we do want to avoid the eyes, the mouth, cut or irritated areas on the skin. And also just covering up. If you're walking out with a baby in the stroller, try to during a peak biting time, during sunset, then try to cover that stroller up. Use a netting if possible, or a blanket or something like that. Throw something over the baby carrier that just keeps them protected, especially if you're not planning on using repellent on them. The use of permethrin, this is a widely used insecticide that is applied to clothing. So it's labeled specifically for that use. It's never applied to skin, but it is applied to the clothing. And there are some pre-treated formulations that you can get. You can actually buy clothing right off the rack that has 60 to 70 washes of repellent action from having permethrin in it. U.S. military use permethrin in most of their uniforms all around the world to provide protection against a variety of different blood-sucking organisms. But we can use it commonly here. You can also just buy it over the counter to treat your own clothing. You can get probably 6 to 7 washes or 6 to 7 weeks of repellency out of it for that purpose. So a lot of hunters swear by this stuff too. So it's a good option for you. And then avoidance is really important. We talked about the daytime biting activity, but especially at dawn and dusk, you really want to look out for those bites. Using air conditioning when you can. This is one of the biggest things that probably separates us from the tropics when it comes to some of this mosquito-borne transmission, is we don't have as much of an open air style of living in general here in the United States as they might have there. We have more screens on the windows. We have more people that are using air conditioning. And the mosquito that does get inside, because these mosquitoes do like to try to get inside, even when the air conditioning is running, is not going to survive as long as a mosquito that gets in a really humid house that's got the windows thrown open. So it's really important to keep those doors and window screens in good repair, and avoid the ones that can get in, because one infected mosquito that does get in can infect a number of people in that house if it does get inside. So there's a lot of misinformation out there about Zika, but the best places to get information are places like the Pan American Health Organization. Centers for Disease Control is your best one-stop shop as far as getting updated advice for travelers, updated advice for pregnant women, and the best information that we have about Zika right now is here in the U.S. is definitely coming out of the CDC. So that's a great place to start. Virginia Department of Health has their plans published there for their Zika action plans, and among other things, like Sean was talking about, some of the case data for the state and for the region. And we'd love it if you go to our health department webpage too, where we've got a wide variety of different outreach materials available. I've got some examples of some things that we've developed specifically this year for Zika, and they include information about West Nile virus too, because that's one of those viruses that is here year after year that we know is going to be present, in life after Zika. So please do check out that site as well. And if there are any folks that want us to deliver materials to them or would like something, we're happy to provide whatever we can. We've got a lot of these things already printed and ready to go. And we'd love to come out and take a look in people's yard too if they request our presence out there to help them figure out where mosquitoes might be coming from. So if folks have questions, they can direct them to us here at the health department, and we're happy to try and answer whatever we can. All right. Thank y'all.